Hello everyone, I am Dr. Puja Rai and I'll be discussing on topic salivary gland diseases. There are three major salivary glands in our oral cavity: parotid, submandibular and sublingual glands. These glands are paired and secrete highly modified saliva that comes into the oral cavity through a branching ductal system. There are also thousands of minor salivary glands that are distributed throughout our oral cavity, and most of which are named for their anatomic location. These minor salivary glands are located just below the mucosal surface and communicate with the oral cavity with their short ducts. Saliva is the product of major and minor salivary glands which are dispersed throughout the oral cavity. It is a highly complex mixture of water, organic and inorganic components. Most of the constituents are produced locally within the gland and others are transported from the circulation. Coming to physiology of salivary gland, property of saliva. The volume of saliva which is produced per day is 1 to 1.5 liter of saliva per day, out of which 25% secretion comes from parotid gland, which is predominantly serous, 70% from submandibular gland, which is predominantly mucous gland, and 5% from sublingual gland, which is mixed gland. The pH of saliva is 6.35 to 6.38. Specific gravity is 1.002 to 1.012 and tonicity of saliva is hypotonic. Regulation of salivary secretion. Physiological control of salivary gland is almost entirely by autonomic nervous system. Parasympathetic effect predominates. If parasympathetic innervation is interrupted, glandular atrophy takes place. Parasympathetic stimulation produces watery saliva. The normal saliva has 99.5% water, and as already discussed, the normal daily production is 1 to 1.5 liter. Now starting with xerostomia, which is a Greek word. Xeros means dry and stomia means mouth. Xerostomia can be defined as a subjective sensation of oral dryness that may or may not be associated with a reduced salivary output. Etiology of xerostomia can be aging, systemic factor that the patient is suffering from, radiotherapy, Sjogren's syndrome, medications, salivary gland pathologies. There are about 400 medications that can produce side effect of xerostomia. It can be antacids, anti-anxiety drugs, anticholinergic, anticonvulsants, antidepressants, antiemetic drugs, antihistaminics, antihypertensive, antiparkinsonian drugs, and antiepileptic drugs. It can be bronchodilators also, cholesterol-reducing drugs, decongestants, diet pills, diuretic, even hormonal replacement therapies also have side effects of xerostomia, muscle relaxants, narcotic analgesics, and sedative, to name a few. Now coming to clinical features of xerostomia, patient can complain of thick viscous saliva, sticky saliva, difficulty in eating, talking, swallowing, halitosis from the oral cavity, altered taste and smell sensation, complain of oral dryness with burning sensation of mouth, lips and tongue. There can be increased rate of caries, gingivitis and periodontitis, food sticking to the oral structure, cracking and fissuring of tongue, ulcerations of oral mucosa, no or reduced pooling of saliva in the floor of mouth, recurrent candidal infections, a toothbrush, mouth mirror or instrument that stick to the soft tissue, poorly fitting prosthesis. We have some signs for xerostomia. Lipstick sign, that is the presence of lipstick or shed of epithelial cells on the labial surface of the anterior maxillary teeth, which is indicative of reduced saliva flow. Saliva would normally wet the mucosa and aid in cleaning the teeth. Tongue blade sign. The examiner should hold a tongue blade against the buccal mucosa in a dry mouth. The tissue will adhere to the tongue blade as the blade is lifted away. Both the signs suggest that the mucosa is not sufficiently moistured by the saliva. Now, now, if we want to quantify the exact amount of saliva which is produced in the oral cavity, we have to follow the saliva collection methods. Now, the saliva flow rates can be calculated either from the individual major salivary glands or from a mixed sample of oral fluid, which is termed as whole saliva. There are several methods of collecting whole saliva in the oral cavity, which includes draining method, suction method, spitting, and absorbent method. Spitting and absorbent methods are the most commonly used method. In spitting method, the patient allows saliva to accumulate in the mouth and then expectorate in the pre-weighted tube, usually once every 60 seconds for 5 to 15 minutes. In absorbent method, pre-weighted gauze sponge is placed in the patient's mouth for a set amount of time. In a stimulated whole saliva collection method, a standardized method of stimulation should always be followed. Chewing unflavored gum bases or inert materials such as paraffin or a rubber band at a control rate, usually 60 times per minute, is a reliable and reproducible means of inducing saliva secretion. For research investigations, 2% citric acid is placed on the tongue at 30-second intervals. To ensure an unstimulated sample, patients should be refrained from eating, drinking, and smoking or any oral stimulation like oral hygiene practice for 90 minutes prior to the collection. For general assessment of salivary function, unstimulated whole saliva collection is the recommended method. Unstimulated whole saliva flow rate of less than 0.1 milliliter per minute and stimulated whole saliva flow rate of less than 0.7 milliliter per minute are considered abnormally low and indicative of marked salivary hypofunction. Coming to management of xerostomia. First, increase in the salivary flow rate. Using drugs that mimic or stimulate the parasympathetic division of autonomic nervous system, like pilocarpine and cevimeline. Using citric acid containing lozenges and candies that are sugar-free. Use of artificial saliva is also recommended. Preventive therapy in the form of supplemental fluoride or non-chorionic diet, symptomatic treatment in the form of constant sipping of water, oral rinses, gels, mouth washes, increased humidification, and minimize intake of caffeine and alcohol. If patient is suffering from underlying systemic disorders like xerostomia or nutritional deficiency or many more, the therapy of underlying systemic disorder is always recommended. Now, treatment of xerostomia and associated problems. Like for dental caries, daily use of fluoridated dentifrices is advisable. Daily use of prescription fluoride gels. Application of 0.5% sodium fluoride varnish to the teeth. Dental examination at least every 6 months and bite-wing radiograph every 12 months for early diagnosis. If patient is having dry mouth, we can advise oral moisturizers, lubricants, mouthwashes and spray, sugar-free gums, mints and lozenges, artificial salivary replacements, prescription silogogues in the form of pilocarpine 5 mg 3 times per day at bedtime or cevimeline 30 mg 3 times per day. Lubrication on lips every 2 hours is advisable. Use of bedside humidifiers during sleeping hours. If patient is having dysgeusia, drinking of fluid while eating is advisable. If the patient is having dysphagia, careful eating with fluids, copious use of fluids while meal, avoidance of dry, hard, sticky, and difficult to masticate food. If patient is having oral candidiasis, antifungal rinses in the form of nystatin oral suspension, rinse 4 times per day. Antifungal ointments can be advised to the patient, applied 4 times per day. Antifungal lozenges to be dissolved in the mouth. Then, if patient is a denture wearer, denture antifungal treatment with daily hygiene of the denture in the form of soaking prosthesis for 30 minutes in benzoic acid or 0.12% chlorhexidine over 1% sodium hypochlorite is advised. If patient is having bacterial infection, systemic antibiotic therapy for 10 days, amoxicillin with clavulanate or clindamycin or cephalexin can be advised to the patient. Increase in the hydration of the patient is advised. Salivary stimulation with sugar-free gums, mints and lozenges are advised to the patient. If patient is having poorly or ill-fitting prosthesis, soft and hard tissue reliners by the dentist is advised. Use of denture adhesive is also advisable. Thank you.